Hello and welcome. My name is Emilee Escher, and I am a Doctor of Nursing Practice student. Presently here to talk with you about the DNP's scholarly project of reducing bronchodilators in pediatric bronchiolitis. This project is in partial fulfillment requirements for the Doctor of Nursing Practice degree at Maryville University. To begin, I will address what bronchiolitis is and its significance. Bronchiolitis is a common pediatric illness in infants under the age of 2 years old. It involves the acute inflammation of the epithelial cells lining the lungs due to mucus production. The most common cause of bronchiolitis is the respiratory syncytial virus, or RSV. The bronchiolitis causes infant hospitalizations hundreds per year in the United States. It is one of the most common reasons for hospitalization in this specific population. The American Academy of Pediatrics developed bronchiolitis clinical practice guidelines to aid the clinician's management in the treatment of bronchiolitis. The American Academy of Pediatrics, or AAP, strongly recommends against the use of bronchodilators as a management modality. Bronchodilators are medications such as albuterol. They are designed to open the airway in the event of an airway restriction. Most commonly, bronchodilators are used for asthma exacerbations. Bronchodilators have many side effects, such as increase in heart rate, tremors, nausea and vomiting, and even cardiac arrhythmias. Based on years of evidence-based research, the AAP has found bronchodilators have no resolution on bronchiolitis, and therefore the cons of potential uncomfortable and dangerous side effects of bronchodilators outweigh any potential temporary improvement in clinical symptoms of bronchiolitis. Several meta-analyses and systematic reviews have found that the dangerous side effects of bronchodilators outweigh any potential transient improvements in clinical symptom scores. They also found that these medications do not affect disease resolution, the need for hospitalization, or the length of hospital stay. The benefits of avoiding the administration of bronchodilators to children with a diagnosis of bronchiolitis is strongly aligned with evidence that suggests coinciding avoidance of adverse effects, ongoing use of ineffective medication, and lower hospital costs. Bronchiolitis is airway inflammation that is not caused by the same modalities as an airway obstruction in asthmatics. Due to similar clinical presentations and perhaps pressure to treat, bronchodilators continue to be used in the management of pediatric bronchiolitis, despite recommendations for supportive care, such as normal saline spray for the nares, supplemented oxygen as needed, and adequate hydration. And at an acute care hospital located on the eastern seaboard of the United States, it was found that a hospital-wide policy did not exist to guide the nurses and other healthcare professionals in the decision-making efforts for bronchiolitis treatment. The pediatric hospital is the largest freestanding children's hospital in the region, and the unit that this project took place on is a 39-bed unit that is designated for infants inflicted with respiratory illnesses. It was observed a lack of consistent evidence-based decision-making occurred when managing infants admitted to the hospital diagnosed with bronchiolitis. Oftentimes, clinicians and respiratory therapists were trialing albuterol or bronchodilators in the emergency setting. And then once the patient was admitted to the inpatient floor, these bronchodilators were not discontinued despite no resolution of the illness. The nurses are at the bedside of these patients, assessing at a much more frequent rate, and often are the coordinators of care between practitioners and respiratory therapists. The pediatric nurses at this acute care facility work in conjunction, in partnership with these pediatric respiratory therapists and advanced practitioners. The nurses use Pediatric Early Warning System scores, or PEWS scores, in the electronic medical record to assess severity of symptoms and determine when next level of care is necessary. PEWS scoring tools incorporate clinical information such as vital signs, change in behavior, as well as work of breathing and perfusion. The Pediatric Early Warning System, PEWS scores, is found in research to be a reassuring system that can effectively quantify the status of acutely ill children in the hospital, which enables early recognition of clinical deterioration by staff and timely management of a change in a child's clinical status. Respiratory therapists had a personal access to bronchiolitis respiratory pathway. This was their method for scoring a child based on a respiratory score and then deciding whether or not to give bronchodilators. The issue was respiratory therapy was the only department who had direct access to this scoring system. Thus, the need for quality improvement was identified, as the therapists would carry this algorithm around on their badge inserts, but other departments such as nursing did not have access. The question of inquiry was, does the implementation of a hospital-wide policy that reflects the American Academy of Pediatrics clinical bronchiolitis practice guidelines help decrease the usage of bronchodilators in infants diagnosed with bronchiolitis, and therefore improve pediatric early warning system scores? The aim of this project was to reduce the adverse effects from bronchodilators in infants with bronchiolitis by decreasing the unnecessary use of bronchodilators through the implementation of a hospital-wide policy, thus improving pediatric patient outcomes and PEWS scores. A quantitative exploratory design through a retrospective chart review was utilized for this project. A comparative research design was also utilized to compare between pre-intervention and post-intervention statistical analysis, respectively. The intervention included both formal and informal education to the nursing staff. With the assistance of the Maryville statistician, SPSS statistical software was used for data analysis. To manage the data was just transcribed onto an Excel document. The nominal and ordinal data were uploaded to SPSS, and descriptive statistics were utilized to guide the statistical analysis. The type of statistical test run for the independent ordinal data was the Mann-Whitney U-test. The independent variables are the pre-intervention and post-intervention, and the dependent variables are the PEWS scores. The standard deviation of the Mann-Whitney effect size was to be 0.5 with a significance of 0.05. The achievable value was 0.8 to determine the significance of the project. After obtaining Internal Review Board IRB approval from both the healthcare system and the university, a pre-intervention retrospective electronic medical record review was conducted in the fall of 2021 through the spring of 2022. A list of patients admitted to the hospital for bronchiolitis during this time was obtained from the nurse manager. The list was kept on a password-protected computer in a locked office without any other human access. This was a retrospective chart review, and participants were not engaged. The inclusion data included infants less than 24 months of age, of any race or ethnicity, diagnosed with bronchiolitis, and without any comorbidities. Each admitted patient's chart was scrutinized for exclusion and inclusion criteria. The chart was closed and no data was obtained if the patient was 24 months of age or older, or if they presented with other comorbidities other than the bronchiolitis. If no exclusion criteria existed, the following data was collected. 1, did the patient receive bronchodilators? 2, the average of Pew score during the child's stay. And 3, the length of stay in days. Concurrently, a self-created pre-intervention survey was administered to the nursing staff. This was a 5-item multiple choice survey based on the American Academy of Pediatrics Bronchiolitis guidelines. The pre-intervention survey was filled out anonymously by the nursing staff and deposited into a lockbox in which the author, myself, was the sole owner of the key. Following the initial retrospective chart review and completion of the pre-intervention survey, education was provided to all of the nursing staff regarding the recommendations put into place by the American Academy of Pediatrics for the treatment of bronchiolitis in infants per the clinical practice guidelines. The education consisted of a self-created poster. This was based on the AAP clinical practice guidelines and presented at morning huddles and in staff meetings. A second EMR retrospective review commenced in the fall of 2022, in which the participants again were not engaged. The same anonymity and security measures were implemented as before. The collection process stopped when the researcher, myself, satisfied the minimum requirement of 106 EMRs. There were 53 EMRs on each side of the intervention time frame. The minimum necessary data to accomplish the goals of the study was recorded on the data collection sheets. No informed consent was required for the retrospective chart review because no interaction with the patients occurred. No informed consent was required as well, and no conflict of interest was identified. The post-intervention survey was then dispersed among the nursing staff. This survey contained the same questions as before in order to measure a change in knowledge. Quality measures of the project focused upon improving the clinical decision-making process and pediatric patient outcomes. And process measures incorporate evidence-based practices into improvement efforts affecting the outcome measures. And the outcome measures evaluate the effect of care on the patient's health, such as intended or unintended effects of care provided. And these outcome measures were also utilized to determine if the goals of the study were met. The study's primary outcomes were evaluated by comparing pediatric early warning system scores and the administration of bronchodilators within the EMRs. The Mann-Whitney U-test was conducted to determine whether there is an increase in knowledge among the nursing staff of the AAP guidelines between the pre-intervention and post-intervention phase. The results indicated a statistical difference between groups with a p-value of 0.04. Therefore, the results provide support there is a probability a relationship exists between the implementation of a pre and post intervention and an increase in knowledge of the American Academy of Pediatric Bronchiolitis clinical guidelines amongst the nursing staff. With the highest score of a 5 and the lowest score of a 0, there was an improvement in the scores when comparing the pre and the post-intervention results. The Mann-Whitney U-test was also conducted to determine whether there is a relationship in the pediatric early warning system scores between pre and post intervention and the administration of bronchodilators in pediatric bronchiolitis patients. The results indicate a statistical difference between groups with a p-value of less than 0.001. Therefore, there is strong evidence against the null hypothesis and conclusion that there is a high probability a relationship exists between the implementation of the AAP clinical practice guidelines and the administration of bronchodilators with Pew's scores. Data gathered from the EMRs also included the length of hospital stay per retrospective chart review. And the length of hospital stay in days was recorded in conjunction with the comparison of administration of bronchodilators against those patients who did not receive bronchodilators. The desired outcome was to make an observation of whether the number of days was comparative, and the pediatric patients pre-intervention average length of stay was about 2 days, whereas post-intervention the average length of stay was 1 day. The data, however, was inconclusive as to whether or not there was a true decrease in the usage of bronchodilators between the pre and post-intervention time period. This was in part due to time constraints and limited chosen population size. The outcomes of this study suggest a high probability of a relationship between the implementation of the AAP clinical practice guidelines and the administration of bronchodilators with Pew's scores. The outcomes of this study also increased knowledge amongst the nursing staff of the AAP clinical practice guidelines. And furthermore, the project successfully aided in the implementation of a hospital-wide policy to reduce bronchodilators in pediatric bronchiolitis in the acute care setting. A brand new policy was put into place on January 19th of 2023, and the selected study timeframe, a rapid increase in bronchiolitis cases, electronic medical review of Pew's with bronchodilator usage, sharing of knowledge by the researcher as the project progressed, and a call to attention of a significant topic that needed to be addressed all played in the outcomes of this study. This retrospective study was implemented to assess the relationship between the use of bronchodilators in pediatric bronchiolitis and pediatric early warning system scores before and after the implementation of evidence-based guidelines for the treatment of bronchiolitis in infants. Bronchiolitis is one of the most common respiratory syndromes in children under 2 years of age. The condition is associated with high utilization of healthcare resources, including hospitalization. According to the AAP, bronchodilators are not recommended for the management of bronchiolitis. And despite the evidence recommendations, it was discovered there is a substantial use of bronchodilators in the treatment of infants with bronchiolitis at an acute care children's hospital. A lack of hospital-wide policy lays suspect for the discrepancy in care and the overuse of bronchodilators. And therefore, I aimed to implement an evidence-based guidelines policy on the management of bronchiolitis. In comparison to other similar published research, this retrospective study yields comparable results in regards to efforts of reducing bronchodilators in pediatric bronchiolitis. Much like comparable studies, this project demonstrates the need for evidence-based research, education among healthcare providers to reduce the unnecessary and potentially harmful effects of bronchodilators in infantile bronchiolitis. The strengths of this scholarly project are demonstrated by the recent addition of a hospital-wide policy on the management of pediatric bronchiolitis at the acute care pediatric hospital in which this study was conducted. The strengths of the capstone project also underline the significance between the use of bronchodilators and the effect this has on Pew scores, which directly influences clinical decision making. The project also demonstrates a symbiotic relationship between the implementation of education and knowledge of evidence-based concepts of care amongst nursing staff. The research project results may enable similar studies for the continued efforts at improving pediatric patient outcomes. While the research project demonstrates several strong aspects, the discussion of potential limitations are also evaluated. The scholarly project does not have a good generalizability. The project is aimed at a very specific population of patients, and the study also was unable to truly determine whether there is a reduction in the use of bronchodilators between the pre-intervention and post-intervention phase. The study size of 106 EMRs chosen at random and pertaining to inclusion criteria, an exponential amount of EMRs were left unstudied, and this directly impacts the researchers' my ability to statistically determine if the use of bronchodilators was diminished. The effects of these limitations do not impede or discredit the results of this scholarly project. The barriers and an exceptional level of support helped overcome the barriers of the project. The manager, nursing administrator, supervisors, the director of nursing at the hospital were all on board with the continuity of the project and enabling me to complete the project and all the necessary steps. In addition, Maryville University's astute professors and assigned DNP chairperson facilitated the timely completion of the project within an appropriate timeline. And the educators at Maryville University played an integral role in supporting myself throughout the entire project. Recommendations for future practice and research urge the continued efforts to reduce bronchodilators and pediatric bronchiolitis. The scholarly project supports the ongoing evidence that bronchodilators are not effective in the management of infants under 2. I thank you sincerely for taking the time to listen to my presentation. Here's my contact information and references available upon request. Thank you.